Hi, everybody. My name is Marco Baptista. I'm the Chief Scientific Officer at the Christopher and Dana Reeve Foundation. It's my privilege today to be moderating a very distinguished panel on a really important new pivotal trial called Empower BP. And this is a clinical trial that is testing the ARC-IM, the implantable epidural stimulator from Onward Medical, to test to see its safety and efficacy in blood pressure instability in chronic SCI. So I'm really happy that everyone's joined us. Maybe if we could go to the next slide, I can introduce the panel. So a very distinguished panel to talk about a very important issue, and you'll hear from the presentation today the challenges in treating blood pressure instability, both the orthostatic hypotension and also the autonomic dysreflexia. And this is a new technology that potentially could be addressing something that has been a challenge in the field. So we have here Dave Marver, who's the CEO of Onward Medical. We also have Gretchen Nelson, the Senior Director of Clinical Operations at Onward Medical. Dr. Candice Turfetiller, who is the Empower BP Principal Investigator at the Craig Hospital in Denver, Colorado. We have Dr. Jim Guest, who is the Empower BP Medical Monitor, based at the University of Miami in Florida. And we have two ARC-IM trial participants who will be sharing their experiences and their journeys at the end with the moderated session. We have Julie Verlinden and we have Nuno Abreu, who will be talking about their experiences. So given that there are a lot of time constraints with this webinar, if you look at the chat, there is a link there that if you do have any questions, you can post and any other inquiries. But we've moderated the session based around the personal experiences of Julie and Nunu around the science and the evidence, talking to Dr. Turfetiller and Dr. Guest. And also we'll end it with Dave Marver and with Gretchen Nelson discussing the accessibility to the Empower BP trial. So I think we're going to have everything pretty much covered with our moderated questions, but if you do have other questions, please go to the link. And now I'll pass this off to Dave Marver.
Well, thank you, Marco, and thank you to our excellent partners at the Reeve Foundation for hosting this webinar today, and thanks to all of you who are joining us. If you don't know about Onward, we are a company that is solely dedicated to developing technologies and therapies to help people with spinal cord injury recover movement and other critical functions. We have one technology that's already commercially available, already FDA approved. It's called ARC-EX. This is a transcutaneous stimulator. Increase the odds of, okay, you can't see it using one of those backgrounds. But in any case, this is a tabletop device. It's available in the US. And we recently also received CE mark, which allows us to make this available in Europe. This study, Empower BP, is called a pivotal study. And the intent is to accumulate or obtain the data required to get FDA approval and CE mark for this device, our implanted neurostimulator called ARC-IM. And the first indication that we're pursuing is blood pressure instability, which shows you that we recognize the importance not only of restoring movement, but also autonomic functions lost after an injury. And we're super excited to get this study started. We're investing about $25 million in this study. And once this device is approved, we can use it for other indications, other recovery targets in the future. So thanks so much again for joining, and I'll hand it over to Gretchen Nelson, who leads our clinical operations.
Thank you, Dave. Welcome, everyone, for joining us today. I'm going to discuss with you the Empower BP study, which is a global pivotal study, as Dave mentioned. We have leading centers in the US, Canada, and Europe that will be involved in this. There's a minimum of 60 implanted participants, and the participant involvement will span 24 to 48 months total for this study. Dave also mentioned that we decided to focus on symptomatic blood pressure instability because we recognize that autonomic dysreflexia is very important. Blood pressure can fluctuate between low and high, and so we're doing this clinical trial to focus on stabilizing the blood pressure instability that everyone feels after an SCI injury. That consists of low blood pressure, also called orthostatic hypotension, as well as high blood pressure, which is autonomic dysreflexia, where the body tends to increase the blood pressure and give such things as headache, heart palpitation, goosebumps, and can lead to a very severe event. And so we're really hoping that we can focus the study on minimizing that for all SCI patients involved. Why now? Why are we doing this? Well, it's an underappreciated unmet need. Results have come out that have shown that both orthostatic hypotension and autonomic dysreflexia are severely underdiagnosed and undertreated. So 78% of OH patients with tetraplegia are diagnosed, and 28% of those are treated. Still being treated, 91% of them experience symptoms. Very similar results have come out with autonomic dysreflexia, where 82% of tetraplegia are diagnosed with AD, and only 30% are being treated, and 98% of those treated still experiencing symptoms. Really, the issue here in the treatment is that there is not good treatment for patients. Medications are years old, 30, 40 years old, and garments that patients wear can not really treat the problem that's out there. So many people at this point just avoid and adjust their daily routines to help with the instability, and it really affects their quality of life. Over time, this can hinder neurological recovery and cause really harmful cardiovascular health. The ARC-ISM system that we have is consists of a neurostimulator that is implanted in the abdomen and a spinal cord stimulator that sits along the spinal cord. It targets the hemodynamic hotspots within the spinal cord, which is a key region for the blood pressure regulation. And we have a slide here that it shows you exactly how this therapy works. So as I mentioned, the implant itself, which is an IPG that Dave showed us, is implanted in the abdomen, connected to a lead, also called a spinal cord stimulator that sits along the spinal cord. The lead hits that hemodynamic hotspot that then triggers the ability to manage the blood pressure for patients. It is an area that is an optimal site for this treatment. And you can see here that when it's deactivated or no stimulation is happening, very low blood pressure. And as soon as the stimulation is turned on, blood pressure increases in these patients. We have recently released results in a Nature Medicine publication of our preliminary clinical feasibility studies. Within those studies, we were able to show the results on the next slide. An immediate increase in blood pressure, reduced frequency and severity of hypotension symptoms, and increased cerebral blood flow. Patients were also reporting less reliance on using their blood pressure medications and the compression garments that I discussed. They had reduced fatigue, better quality of life, improved bowel movement, increased tolerance of the upright position, and then just greater engagement in rehab so that they can move towards working on mobility. We used all of this data to inform the design of this Empower BP study that I'm going to go in detail about right now. So it's a global pivotal study, meaning that we are enrolling patients from around the world. The pivotal study will then be used to submit the data to the FDA for marketing approval. We have centers in Canada, the US, and Europe. We're looking at up to 22 sites and a minimum of 60 participants. The study is a randomized controlled double-blind study. And I know that's a lot of big words, but what it means is that we have patients that will either receive one therapy or another. So a certain therapy or a sham therapy. And then they will all cross over to receive the same therapy at the 3-month primary effectiveness endpoint. The study will continue for 6 months till our safety endpoint, and then all the way through a long-term follow-up of up to 24 months. The expected research benefits that we should see that we saw in our feasibility study remain the same: stable blood pressure, increased tolerance to position transfer, improved mental awareness, increased physical activity, greater engagement in rehabilitation and activities of daily living, and then overall, the most important thing, improved quality of life. As with any clinical trial or implantable device, there's potential risks and side effects. There's risks associated with surgery alone, and then risks associated with the implant being implanted into the body. These are risks that people take with any spinal cord stimulation surgery that has been occurring for greater than 50 or 60 years from now. So participant criteria to be included in the study. There's lots of criteria. So and if you're interested, you can talk with your potential study physician. But the main criteria to be included is a chronic indication of spinal cord injury, so greater than 1 year, aged 18 to 75, the injury occurring between C2 and T6, the diagnosis of hypotension, so that sustained hypotension of less than 110 in a seated position, having no history of hypotension prior to your injury, an ASIA score of A, B, C, or D. To be excluded from the study, you would have to have had a history of heart attack, severe heart rhythm disorder, or stroke in the past 6 months, kidney or liver disease, be on a ventilator, have an active implanted medical device like a baclofen pump or a pacemaker, be pregnant or breastfeeding, or also be unavailable to receive a spinal MRI. The study journey consists of first interest to be a part of the study, and then screening and baseline, where you'll be determined if you're suitable to enroll in the clinical trial. After that, you will undergo that intervention in the placement of the ARC-IM system that we reviewed prior. And then the follow-up schedule will happen and go through 24 months. To learn more about Empower BP, we have a website. It's listed here, onward.com/empowerbp. On that website, we'll have information about the clinical trial, study centers that will be included, and ways that you can get connected to be a part of this clinical trial. Thank you so much. I'm going to turn it over to Marco, who will help us with our panel discussion.
Thank you so much, Gretchen. So the first session will be about the personal experiences. So we have Julie and we have Nuno, who we're all really interested in hearing the experiences that you have. Maybe we can start with getting an understanding of what your personal journey was and how blood pressure instability was affecting your daily life. And maybe we can start with you, Julie.
Yeah, so hi everyone. My name is Julie Verlinden. I'm 26-year-old from Belgium, and I have a C5 Asia B spinal cord injury. It happened in January 2022. I had very severe hypotension problems after my spinal cord injury. I wasn't really able to be in any upright position for a very long time, was very fatigued, had the impression that my head was in a sort of zombie state. I couldn't think very clearly. Yeah, fainted multiple times a day. was very, very difficult. I received the RKM implant in the summer of 2022. So quite recent after my injury, but I remember from the minute the engineers switched the stimulator on, that my oxygen levels in my blood raised again to a normal level. It felt as a sort of awakening from a very, very long sleep or a zombie state. I was able to engage myself way more actively in rehabilitation. I was able to go to work again. I am currently also pursuing my PhD again. So it allowed me to, yeah, live an active life, go out, travel again. I don't faint anymore. I feel much better also mentally. So it's a huge change in my life. Yeah.
Thank you, Julie. And Nuno, same question, a little bit about your personal journey and about the blood pressure and stability.
So hi there, everyone. Thank you, Marco. My name is Nuno. I'm 46 years of age from Lisbon, Portugal. I had a surfing accident in 2021, September, and one of my biggest problems was orthostatic hypotension. I knew I had it because while in rehab center, I was trying to use the standing frame for rehab, and it wasn't possible. I lost my senses multiple times, as Julie was saying, and so this was hindering completely my rehab process. And then I enrolled. I applied for the Human trial. I was implanted in May of 2022, so 6 months after the accident. And although I knew that I was hypotensive, um, I didn't know how much hypotensive I was and how that impacted my life really. I mean, I was exhausted all the time, as Julie was saying. I was um, unable to do most of the things that normal people do. I have two children and I am married, and my life was kind of over. And just like as Julie was saying, when they turned the device on, in my case, I felt like my eyes were opening again, and I didn't even realize how close they were. And I am sure that most of the people with SCI, as we saw, 90% or more have hypotension, and we don't even realize that we have our eyes closed. And using this device completely changed my life, made me able to have a near normal life with my kids, with my wife. I do everything that a normal parent would do. I can stand up on the standing frame, and this allowed me to leave the compression garments, allowed me to leave to get dressed much quicker, don't have an abdominal belt, don't use medication for blood pressure. So my quality of life, my my effectiveness in my day improved from 0 to 100%. I'm able to work again. I am also studying again. So it's without it, I don't know what I would do. And so I advise it to everyone.
Yeah, thank you for sharing, Nuno. Maybe we can you can expand a little bit on that of what you were trying to do before the ARC IM. You mentioned maybe there's medications or other types of therapeutic approaches, and how was that managing blood pressure and stability like that?
Sure, Marco. Well, the measures to treat orthostatic hypotension are very ineffective, to tell the truth. So there are recommendations to have a higher salt intake. Uh, well, you use mechanical compression garments, so very long socks from the foot to the hip. They are very difficult to wear, very difficult to put on. So anyone that uses them knows this. They are also very hot in the summer, and so you can get so it's contradictory because you get hypotensive although you are wearing them. then it's also bad for your skin because they are tight on the skin. Then you use an abdominal belt, which really tightens. So all of this takes a really long time to put on in the morning, and you need kind of a team to do this. Um, on the other hand, there's another very important thing, which is you are not able to put yourself in an upright position, so you have a lot of spasms, and putting yourself in the upright position has the effect of reducing spasticity. And in my case, I also stopped taking antispastic medication. This improved also my mental ability, made me cognitively much more aware. I didn't know that antispastic medication was as sedative as it is, and it truly is. So these are layers and layers of hindrances that I had, and that they completely disappeared, and you get stronger by the day. I just felt energy coming, and I was ready to go back to normal life.
That's great.
Basically.
Thanks, Nuno.
Thank you,
And
Michael.
Julie, similarly, it sounds like it was a huge challenge for you prior to using the ARC-IM, but curious to hear how you were trying to manage your blood pressure and stability.
Yeah, as Nuno said, it was quite difficult to manage it at all because medication, garments, compression socks, all these things weren't really working. And it is very hard to have these socks or binders on for the entire day. It's very uncomfortable. And in my case, medication was not effective as well. So, I mean, I was out of options, let's say. It was very, yeah, I was at a point where I've tried it all and it didn't really work. Yeah.
Thanks, Julie. And just to continue with you, how did you get exposed to the ARC-IM and participate in the research?
Well, while I was still in the hospital myself after my spinal cord surgery, I started my own research into who was, busy in the field with new therapies or who was actually trying to make a difference for people with spinal cord injuries. And that at that point already, I came across Onward and the team of NeuroRestore in Lausanne. So I contacted them, and that's how we got into contact. We met. We had a video call, and then after my surgeons here in Belgium told me that my options were over and they couldn't really do anything for me, I decided to okay, I need to move ahead and I immediately recontacted the team and we managed to go to Lausanne to do all the checks that were necessary.
Thanks, Julie. And Nuno, a final question. You described a lot of the benefits and how it's changed your life and affected how you're able to interact with family and friends. But any downsides that you've experienced?
No, Marco. In fact, I have really no downsides, just ups. So only when I disconnected for any reason, I miss it. I want to add one thing which is important. It's we need to what I can say very important. It's that when you don't have blood pressure, you don't have blood flowing in your body. So it's like a hose that is not watering a garden, and so your structures, your organs are not getting enough blood, enough oxygen, and you are degrading and deteriorating yourself. And so blood pressure is completely core and central to whatever you want to do in your life. If you would ever imagine or think about trying to get into movement, trying to walk, to get back to another therapy, you will not do it unless you have hemodynamic stability and correct blood pressure. So this is central. Without it, there's nothing.
Thank you, Nuno. And Julie, also final question, just any downsides in your experience with the ARC-IM?
So far, no downsides. I mean, yeah, I can only follow what Nuno said. As from the moment they turned the stimulation on, everything is still going very well. I haven't had any side effects or problems. And yeah, I mean, when I switch it off for any reason, I can still feel the difference between how it was before and how it is now. So in my case, it's really vital. I don't think I would have been here without this device at this stage. So far, so good.
Thank you. Thank you, Julie. Thank you, Nuno, for sharing your experiences. We really appreciate it. We're going to move to the second section, which is the topic of the science and the evidence of how this is working. So we have Candy and Jim on the line. First question for you, Jim, is just how does the ARC-IM work? What's the understanding of its mechanism? Oh, I think you're muted, Jim.
Yeah, so that's really fascinating. So the way that it works is that the epidural stimulator is placed very precisely over the region of the spinal cord that contains neurons that regulate the blood pressure, primarily in what we call the abdominal splanchnic bed. So that's an area, for example, if a person eats and then has orthostatic hypotension, that's where that symptom is coming from. So the electrical pulses enter through these nerve root afferents. Then there's a very critical, what we call interneuron in the spinal cord that was discovered and which was published in the recent Nature publication. This interneuron goes to the neurons in the spinal cord that control blood pressure. And so what's really great about it is it's a way to precisely regulate the activity in these neurons, so it can be dialed up, it can be dialed down, and also because the electrode's relatively long, is possible to capture as long of a span of these neurons as is necessary to get the treatment effect.
Thank you, Jim. Candy, a question I have is just how is this approach with the ARC-IM different from what's out there right now?
Yeah, good morning. Thanks. That's a great question. And actually, Julie and Nuno did a fantastic job answering this for me. So I will likely just be summarizing what they stated. But, you know, our first line of defense in rehab to manage low blood pressure is usually a compression hose. So we're putting hose on both lower extremities, trying to help push that blood back up to the heart. We're usually putting people in an abdominal binder very early after injury, again, just trying to increase that thoracic pressure to keep blood flowing up. And then we're also using things like the tilt table to gradually get somebody used to vertical again, or maybe going straight to the standing frame. Oftentimes, in addition to the tilt table and the standing frame, we'll use electrical stimulation on the lower extremities with the idea, again, that we're trying to push that blood flow back up to the heart. And, you know, our intent early on, and even, you know, into the chronic stages of recovery, is to use those devices to provide that improved blood pressure regulation that the injury has disrupted. But as Julie and Nuno so eloquently stated, they're not very convenient. And so oftentimes, you know, as a therapist, I always sent our patients home with compression hose and binders, and with really good guidelines about when you need to tilt back to, you know, if you're getting symptomatic, tilt back, let your body accommodate, then come back up. But when you think about all of those things, they're so incredibly inconvenient. And when patients would come back to me, oftentimes, I would say the far majority of times, people were no longer using their compression garments or their abdominal binders because of the exact reasons of how difficult it is for caregivers to put them on, how much time it takes, and how uncomfortable they are. And so, you know, from a non-pharmacology standpoint, those are the first lines of defense that we have in the clinic to manage low blood pressure. And then in addition, we also usually use a combined approach of pharmacology with those non-pharmacological approaches. again, sometimes pharmacology works, sometimes it doesn't. And then oftentimes people just don't like the feeling of having to take meds all of the time to maintain that upright blood pressure. So you often hear that people say, well, when my blood pressure gets low, I just tilt back until it comes back up, and then I come back up and keep going on with my daily life. But as we can all understand, that really interrupts what people are trying to do on a regular basis, and just not a great way to facilitate or enable people to get back to their daily lives.
Yeah, thank you, Kenny. I think it's really important for this information to be disseminated of how people are feeling and how the treatments are not working, because there could be this misunderstanding that the treatments are all there, and we can see that people are suffering.
Yeah,
Thank you,
absolutely.
Kenny. Jim, you were mentioning some of the publications that came out. If you could just elaborate a little bit on the Nature Medicine paper and feasibility study and some of the key highlights that came out of it, that'd be great.
Yeah, thanks a lot. So this publication is very interesting because it combines what we call preclinical research, which allows us to really understand mechanisms with clinical research together. And so one of the most important things that was done in the study is that the target was determined quite precisely. And so this was done in the preclinical research, but then in the clinical study, there were parts of the clinical study where lumbar targets and thoracic targets were compared with each other in a very systematic manner. And it was found that the stimulation in this, thoracic hotspots gave the greatest and most stable increment in blood pressure with the least side effects. The other thing is that there were 4 component clinical studies, and in the last 2 these studies, the actual Onward lead was used, and this lead has been specifically designed for this purpose. Other leads that have been tested are actually designed for use in pain therapy. And so this is a very specifically designed lead that matches the architecture of this thoracic area. In the study, there were meaningful and durable effects that were shown. It's very challenging when you introduce the tilt table, and under tilt table conditions, the stimulation was able to maintain a satisfactory blood pressure. The side effect profile was acceptable. And because there were 4 studies and 1 independent study in the Netherlands, it was able to show that the technology implementation is trainable and scalable. Thank you.
Thank you, Jim. Back to you, Candy. We heard about a pivotal trial. The importance of this being a pivotal trial with ARC-IM. It would be, I think, really good for the audience to sort of hear why it's so important to generate this data out of the clinical trial, and how does this translate to getting the technology as a treatment for our SCI community.
Yeah, thanks, Marco. Yeah, this pivotal trial is incredibly important. So a pivotal trial is essentially designed to provide critical evidence on safety and efficacy that can be provided to regulatory bodies such as the FDA, which can approve this specific technology or any medical intervention, so that it really becomes not a experimental, or transitions from being an experimental research device to something that is clinically available. And so if you're, the Uplift trial essentially is a good example of this. For that specifically ARC-EX device, which was a non-invasive spinal stimulator. For those of you who attended that webinar or have experienced the ARC-EX device, we essentially did the Uplift as a pivotal trial. We gathered safety and efficacy data for upper extremity strength and sensation across 14 sites with 65 individuals. And then we submitted that data, and Onward submitted that data to the FDA. The FDA found that there was evidence to support both safety and efficacy for upper extremity strength and sensation. And now that device is on the market and available for clinic use, or to purchase to use in the clinic. And so I think that's a great example of understanding how prior to that device, transcutaneous spinal stimulation in that regard there was not a clinically approved or available device to use. And then after that trial, now there is the ARC-EX device that can be purchased and used in the clinic. So for this specific indication, I would see it in the very same way, is that once the FDA approves the data that comes in terms of safety and efficacy, then individuals who are trying to get access to this type of therapy to improve blood pressure control would now be able to access it in a clinical environment and not just in a research study. So it would really increase access for individuals living with spinal cord injury who have autonomic dysreflexia or low blood pressure issues.
Thanks, Candy. Maybe stay with you a bit in talking about the design of the trial. And Gretchen did mention what the study design looked like and talked about a crossover arm. And I think this is quite important given that there is a control in this study with the sham, what that crossover means for participants in the study.
Yeah, I think this is a really beautiful part of the design of this trial. So anybody who is enrolled in this trial will be randomized into an immediate active group or a sham group. And so those individuals who are enrolled in the active group will start stimulation as soon as they're medically stable and safe to do so. And then the sham group will actually have a 3-month delay in which the stimulator is not turned on during that period of time to measure the outcomes between those two groups. And then after 3 months, even the sham group will get crossed over into the active group so that their stimulator will also be activated and will be on for the remainder of the study. And I can only put myself in the position, try to understand the position of people who would be enrolling in this trial. And I think it makes it much more appealing to me that I would eventually be able to cross over into the active group if I were initially randomized into the sham control group.
Yeah, absolutely. Thank you, Candy. A question for you, Jen, around the actual neurosurgery that's involved, and what's the difficulty in these types of ARC-IM implants?
Yeah, so this surgery to place epidural stimulators is very commonly performed by spine surgeons. And so it's, amongst the surgeries that are normally conducted, this is a very straightforward surgery most of the time. What'll be very important here is the very accurate placement. And so Onward has designed intraoperative protocols to help ensure that the lead positioning is symmetrical and that it's at the right level. And in addition to that, people with spinal cord injury are at an increased risk for infection. So a number of infection mitigation steps have been developed into the protocol. So I think that the surgery is likely to be safe, but I think that because this application is in people with chronic spinal cord injury, there's a lot of due care that's built into the protocol.
Thank you, Jim. And a final question for this session for you, Candy, just how would you recommend approaching one's physician about the issues of blood pressure instability and in joining a trial like this, like Empower BP?
Yeah, I hope that that individuals have a really good relationship with their primary care physicians or the physicians that they're seeing specific to their spinal cord injury. And I think it would be great to have that initial discussion about how blood pressure is impacting your daily life, and also to just think about the ways that maybe you're not even realizing that blood pressure is impacting your daily life. So sometimes I'll talk to people and they say, oh gosh, I never drive right after I eat lunch because my blood pressure always drops and I don't feel comfortable driving. But when you ask them if they have blood pressure issues on a daily basis, they may say no, because that's part of their life that they've just gotten used to, and people are incredibly resilient and they figure out a way to make things work. But I think it would be great for people to really sit back and think about, the things that Julie and Nuno shared with us today. Like, are you feeling foggy headed at times? Are you having to tilt back in your chair frequently? Are you not driving or going places because you feel you don't feel good, or you feel that your blood pressure may bottom out and you may have a hypotensive episode? So I think it would be good first for people to think through all of those instances in their daily lives, which are really keeping them from getting back out in the community, back out to the roles and the lives that they want to live. And then sit down with your physicians and really go through those symptoms and make sure that you and your physician are both well understand how that's impacting your daily life. And if it really seems like those symptoms are directly associated with orthostatic hypotension as a result of your spinal cord injury, then I think investigating your opportunity to be involved in this trial would be a really great next step for you. And I know that Onward has a website and opportunities for people to get engaged through the website. But there's also, I believe, will be a general repertoire of the sites that are involved in this study. And so people can likely reach out to those sites directly. But I think the first step is really understanding how low blood pressure impacts you in your daily life, talking to your physician, and then reaching out about your potential to be involved in this trial.
Thank you, Candy. Appreciate that. Thank you, Jim. So we're now moving on to our final session with the panelists, and that's something that I think is going to be very important for everybody here to understand, and that's the accessibility to the actual clinical trial. But maybe taking a step back, a question for you, Gretchen. Sometimes there's a little bit of confusion when you see in the media that there's something FDA approved, in this case, an FDA approval for the Empower BP. What exactly does that entail?
Yeah, that's a really good question because we have recently issued a statement that we received IDE approval, which is investigational device exemption. That does not mean that the device itself is approved, but it's approved for use in a clinical trial. So it's an important first step at conducting this pivotal trial because there is a huge FDA oversight on just the trial itself. So that's what the IDE approval means that maybe some have been seeing recently.
I think that's very helpful to sort of distinguish this from, previously an FDA approval, for example, for the ARC-EX. Candy was mentioning about the different sites, and just for clarity, how can people find out what sites are close to them that they potentially could participate?
Yeah, it's a great question. I know there's going to be a lot of interest. This is really hitting that unmet need that we discussed earlier. And we have a couple of different options, actually. All clinical trials that patients can look for are listed on clinicaltrials.gov. And so if you were to go into that website, you could search Empower BP and you could see the listing of our clinical trial and the centers associated there. We also, as we've mentioned a couple of times, will have this Empower BP website, which will have specific centers as they open up available for patients to reach out to. And then a third option is the Onward medical website in general. Within that website, we have a clinical trial interest form that's for all of our research studies. So not only Empower BP and the focus on the blood pressure study that we're talking about today, but all of the clinical trials that we're doing at Onward. So a few different options for people.
Yeah, and I just saw on the chat that the website for clinicaltrials.gov was posted, so that's great. I think also a lot of people are going to be asking, yes, the ARC-EM is being used for blood pressure instability, but could it help with other indications like spasticity or mobility? And curious to hear your thoughts.
It's a great question, and I know that is on everyone's mind as the next step or another step. In our feasibility studies, we did look at other indications such as spasticity, and results do look good for a lot of different indications that we would want to pursue at some point. Right now, the Empower BP study will focus on blood pressure and stability. However, we do have other feasibility studies that we are using to also power into a pivotal trial. And so in the future, we have a lot to come, and we're excited as Onward to be able to offer many different approaches to treating SCI and other indications.
And Marco, we do have a clinical feasibility study for urinary incontinence that we're conducting with the support of the Reeve Foundation. So that should be getting underway shortly.
Yeah, fantastic. Very exciting. Thank you. A final question for you, Gretchen. What kind of support is going to be provided for the ARC-IM stimulator once the study is actually over?
So once the study is over, the next step would be for us to collect the data and submit it to the FDA for commercialization. And so once we have commercialization and the devices are out on the market, we will have the ability for the patients that were in the clinical trial to continue being seen by trained physicians who are familiar with it. While the patients remain in the trial, we'll have some that have started very early on, and then we'll have others that will be right there at the end as we commercialize. But we do have a couple of different options for patients as they finish up that 24-month follow-up that we can offer to patients that will continue to allow us to manage their therapy.
Thank you.
Yeah,
Thanks,
thank you,
Gretchen.
Marco. Yeah.
I just have a couple of final questions for you, Dave. I mean, it's very clear to me that this is a major milestone for Onward Medical, having the Empower BP trial starting. But if you could expand on that and clarify why this is a major milestone, I think people would appreciate that.
I think it's an important interim step, but there's quite a bit of work to be done. Our mission is to bring these therapies forward so they're available at scale, get them out of the research realm, into the clinic, into homes, where they can help people in any community, in any country. But to do that, we have to execute this pivotal trial well. And it's also important to look at promising technologies like this in studies like this, where you can see them implanted in 60, 100 people and identify what goes well and what may go wrong. And so that's the purpose of a study like this. But I'm hopeful that we're having another webinar like this in 2.5 years in 2028, where the study's gone very well and we've enrolled quickly and the data are good and we can announce FDA approval. That will be a true milestone. For us, this is just a step along the way.
Thank you, Dave. You anticipated a question that I had, and that's, where does ARC-IM sort of fit within your pipeline and your portfolio of other indications? And you did mention the collaboration that we are doing together for bladder dysfunction.
Yeah, indeed. This is a very versatile technology platform. Already, we have used it or will use it in human or clinical feasibility studies to address blood pressure instability. We plan to address urinary incontinence shortly. We've had active programs for standing and walking, with something we call mobility, for some time, and we're going to progress in that toward hopefully another pivotal study in the coming years. And we're hopeful it can address other recovery targets. What we want to do is really listen to the community, identify what the community's priorities are, and then design and fund studies that can bring these to the clinics and homes where they can really impact people's lives. So this is the first one. Once we establish safety within Empower BP, it will be easier to then get future indications approved. So we're really laying the foundation here. So we really appreciate as well Nuno and Julie sharing their stories, and Candy and Jim as well. We need everybody involved here to have a successful study. And also to raise the visibility for the importance of managing blood pressure instability. This is a very big problem. You heard how it impacts the lives of people like Nuno and Julie, and the clinical community. Doctors around the country need to hear about this and learn about it. And so that when this therapy option is available, people benefit from it.
Absolutely. Thank you so much, Dave. And thank you to all the panelists. I think this was an incredibly informative webinar, very exciting pivotal trial, and research participation will definitely make it a success. So I'd like to thank everybody. Again, you can see the link that's on the chat for more information on the Onward Medical website. And thank you.
If I might, the faster this enrolls, the faster it will be approved. So anybody who is interested or knows somebody who may benefit from this, please reach out. It's really critical. Thank you.
Thank you, Dave. Thanks, everybody.